Have Dr. Mike Ryan, Executive Director of our...
Since the beginning of the pandemic, WHO has emphasized the importance of testing and provide the tools for countries to do it. On the 13th of January, in collaboration with the experts we work with, we published the first instructions for producing tests, just 2 weeks after the first cases were reported. Since then, we have shipped millions of tests and other diagnostic products all over the world. And we have also worked with countries to increase testing capacity.
Please think about your questions now and get them ready.
If you don't know where the virus is, you can't stop it. If you don't know who has the virus, you can't isolate them, care for them, or trace their contacts. But testing must be strategic, in support of clear public health objectives. Everyone who needs a test should get a test. WHO's guidance outlines how countries can test strategically based on their transmission scenario. It's also important to remember that although testing is vital, it's only part of the strategy.
Vaccine from the FDA here.
So every country is going to have to work very hard and is going to have to innovate around systems to actually deliver vaccines that do have an ultra-cold chain. And part of the approach that many countries may take is to choose to use vaccines that require an ultra-cold chain for only certain portions of the population that need to be vaccinated. For example, using that vaccine among healthcare workers, where facilities might be the place where immunization would take place, and therefore installation of a -70 freezer would be more simple.
Is it even realistic to distribute that vaccine?
So I think the main message is that we do have technology. There is demonstrated experience of delivering ultra-cold chain vaccines, even in some of the most difficult and remote areas. But that has also taken enormous resources to do that. So what we do need is we need a variety of vaccines that have different characteristics, and as you know, in the past several weeks have been, through press release, the release of efficacy data on other vaccines that are either kept at -20 or at refrigerated temperatures, which will certainly ease the distribution and use of vaccines. So I hope that
researchers found the virus in samples from last September.
I think it's highly speculative for us to say that the disease did not emerge in China. What we do know is the first clusters of human cases that were detected were in Wuhan in China. There was a massive response to contain that disease there, and we look forward to working with our Chinese colleagues, our Chinese scientific colleagues, to understand better the origins of the virus within China or beyond China, wherever that leads.
Wondered if you think that is necessary, and
it's difficult to weigh in on this. I think what we can emphasize, though, is that from what we understand about the press release, there is certainly something interesting that has been observed, but there are many reasons that could underlie the differences that were observed. And so certainly more information is needed, and that includes evaluations of the immune response in the trial as well. So I think it's too early for us to say anything about what we make of the data and what is needed next.
Dr. Tedros has something to add.
Yeah.